Alright guys, so a short video just on how I manage data for All-on-X same-day conversions. You can see we have a wax up here that was done pre-surgery and a pre-op scan with the teeth remaining. I'm going to bring in my pre-surgery scan with my fiducials, use the teeth to align the meshes here so that we can get a nice perfect match, and then we will use that to align to our post-surgery scan after surgery. I'm going to exclude selected parts and just use the teeth for the matching and not the tissue, because the palate started to swell a little bit once those fiducials are placed, and this just makes the match quite a bit more accurate. So go ahead and exclude everything except for the teeth, and then we're going to match those two meshes. So now we have the meshes aligned. As you can see, we have our fiducial scan, pre-surgery scan, we have our pre-op scan, we have the scan that we waxed to with all the teeth extracted. They're all aligned perfectly. So that means our tooth models that we did our wax up with are also aligned perfectly. So we're going to export some files out into our project. So first thing we'll do is export the fiducial scan. We're going to call this upper jaw-C2 SITU. Then we're going to export our tooth models with the correct positioning. And we're going to duplicate our case, and what we're going to do is we're going to bring in that scan that we saved out, and then we're going to bring all the tooth models for the upper arch, because normally I'm doing this conversion one arch at a time, and for this video I'm just going to do one arch to show you guys how this is done. So we duplicated the case. Now we need to rename it for something else to be able to find it. We need to change our prescription. So we removed all the teeth on the lower arch because we are not converting those. We need to change it to screw retain, scan body, and main scan for all our implant locations. And we need to add virtual gingiva design to all the Ponix designs as well. So we're going to click save. And now we're going to bring in our iCam data, which is our implant position files, and our post-surgery scan, which were matched up in the iCam software. And now we're just renaming it with the project tag for this project so that exocad knows to read these as part of this project. Once we get all those renamed, and we're going to take the post-surgery scan and call it upper jaw. We're going to save it. Everything's lined up. We're going to jump into design. And so now once we're in design, we're going to bring the tooth models in. They line up with our pre-surgery scan. We're going to go into expert mode, and then we're going to align all these meshes together so that we can finish the designs. So first thing we're going to do is use the align meshes tool, and we'll go into the manual part and select additional floating parts, and we'll choose all the tooth models along with the pre-surgery scan. We will move those slightly off of the post-surgery scan so that we can pick points and align these perfectly. Now we're back into the automatically tool. We're going to pick all of those same floating mesh parts, which are the tooth models and the pre-surgery scan, and then we're going to pick our points. We'll pick 5 points on the fiducials and use that to do the matching. That's why it's really critical to have these so that you have common data pre and post surgery to align to. We're going to exclude selected parts and just use the fiducials to do the matching, and then we're going to go ahead and hit perform alignment, best fit matching. Really nice, perfect match. And so now you can jump back into wizard mode and just progress through the design workflow to finish your design and get your prosthetic converted so that it perfectly fits the locations of the multi-unit abutments.